Stern Cardiovascular here in the Mid-South offers a variety of services when it comes to your heart healthcare needs. They're sponsoring our discussion today with Dr. Ari Shahkovsky, and he is talking with us about your calcium score test, joining us via Zoom today. Welcome back to Live at 9, Dr. Shahkovsky.
Thanks for having me. Good morning.
Okay, so what is the calcium score test?
A calcium score test is a CAT scan of your coronary arteries. Those are the arteries that supply your heart. And the CAT scan takes a quick picture of your coronary arteries and measures the calcium in the arteries. Calcium measures the amount of plaque or disease that you have in your arteries. So what the calcium score does is it provides you with a score that indicates the amount of plaque or lack of plaque that you have in your heart arteries.
Why is it important to get this test?
Well, this test provides you with some very important information. You know, it lets you know what's going on in your heart arteries. It's especially helpful for people who have risk factors, smokers, people with family histories. And when we talk about family histories, we mean people in your family, direct relatives, mom, dad, brother, sister, who had heart disease or heart attacks or strokes in their 40s and 50s, people with diabetes, high blood pressure, high cholesterol, inactive, overweight, poor shape, poor health. And this test will give you an idea of whether or not you have any plaque in your arteries. You then get a score. The score can be 0, meaning there's no detectable plaque at all. 0 to 10 is a low score, very low score, almost no plaque. 10 to about 100 is a low risk score, which can indicate very mild amounts of plaque. 100 to 400 is an intermediate amount of plaque, so there could be a moderate amount of atherosclerosis or coronary disease, and then greater than 400 is a high-risk score. The benefit of that is once your doctor or your cardiologist knows what your score is, he or she can then implement a preventive strategy to help reduce the chances that you're going to have a coronary event. Many people who have heart attacks, strokes, or events have no idea that there's a problem until the day of the event. And what this particular test does is it gives your physician some insight into what's going on so that he or she can give you the tools to lower the chances that those bad things will happen.
Okay, now you touched on who should get this test. Is there anybody who should not get this test?
Yeah, people who already know they have coronary disease. If you've had a stent, if you had a heart attack, if you've had bypass surgery, you shouldn't get this test. If you're on the older side, above the age of 80, there's going to be calcium present. It just happens as we get older, so the test isn't as helpful. It may be helpful if you're above the age of 80 and you're not sure whether or not you want to take that statin medication that helps reduce the risk of heart attack and stabilizes plaque. In that instance, you may want to get it because if you know that you've got extensive plaque in your arteries, you'll be more willing to take a medication that can help you. And then the very young shouldn't get it unless there is a significant history of coronary artery disease occurring in very young people in your family, or if there's something called familial homozygous hypercholesterolemia. But typically we don't start getting it until we're about 40 years of age.
All right, Dr. Ari Shahkovsky, thank you so much for this incredible information. We have your website on the screen, sterncardio.com. We'd like to thank Stern Cardiovascular for sponsoring our discussion with the doctor today.